cat, you may wonder if it's worth getting pet insurance. Well, it depends. If you're a good saver and can put away $1 to $3 a day into a separate savings account for your cat, you may be fine without insurance. However, if you don't have that emergency fund readily available, cat insurance may be a good option. Pet insurance is unlike human health insurance, as it's a third-party vendor. That means you still need to pay your veterinary bill up front. Then it's up to you to seek reimbursement later. My veterinary tip? Let your veterinarian or emergency veterinarian know that you have cat insurance, as it gives us the heads up that we will need to submit the appropriate paperwork, get our medical records done in time, and more. The important thing to keep in mind is when you have pet insurance that you need to be responsible to get a copy of the medical record and make sure that your bill or invoice is submitted in a timely manner to get reimbursement. The other important consideration is there are different types of pet insurance coverage. The type of coverage that you get depends on what pet insurance you choose. Some only cover emergency care, while others provide preventative care such as vaccines and wellness visits. My general recommendation is to just get emergency or catastrophic insurance, as an emergency surgery may cost you several thousands of dollars. There are some limitations that you have to keep in mind with pet insurance, such as genetic conditions and age. If you have a purebred cat, there may be limitations on what is covered. For example, if a certain breed has inherited diseases like Siamese cats with asthma, some pet insurance companies may not cover an emergency visit for this. Likewise, pet insurance has certain limitations on age. Typically, it's less expensive when you get pet insurance while your cat is young, as compared to older cats who have a higher risk of cancer, kidney failure, thyroid problems, and heart disease. The next consideration are deductibles on your pet insurance. Just like with your car and home insurance, the lower your deductible, the more you'll pay for your insurance. If you're able to pay a higher deductible, your fees may be lower. I personally recommend going with a higher deductible to help save some long-term costs. There's a couple of considerations and questions to ask before you get pet insurance. As an emergency critical care veterinary specialist, I'm a big advocate for pet insurance for cats because it protects pet owners when a costly emergency visit occurs. However, you have to make sure to read the fine print before you sign up for cat insurance. Some important questions you want to ask include, what percentage of the bill is reimbursed? Are there co-pays? Is the rate increased after a claim? Is there a multi-pet discount? Is there a discount for indoor cats? Are pre-existing chronic or reoccurring problems covered? Are specialty veterinary exams and visits covered? Is there a waiting period? And are alternative medications or treatments covered? Do your research and make sure to stick with a pet insurance that offers you the best reimbursement for expensive care like emergency care, major surgery, and specialist care. ER visits typically will cost you at least $1,000, and surgery can be $3,000 to $10,000. Know that if your cat is high risk for medical problems or accidents, it's worth getting pet insurance. As a veterinarian, I define high-risk lifestyles as cats that live with multiple cats, are overweight to obese, are chewers, in other words, they like to eat rubber bands, dental floss, plants, ribbon, etc., live with a lot of foster pets, exposing them to more infections, are purebred due to some inherited diseases, and have outdoor access. When in doubt, talk to your veterinarian about getting cat insurance. It might just save your cat's life.